discussing chronic disease prevention, and chronic disease prevention. It's part four. We have discussed hypertension, we have discussed diabetes, we have discussed some other diseases as well. So now we are discussing heart failure. Heart failure is a complication of many heart problems. It's basically a complication and culmination of many problems resulting in inability of our heart to pump the blood properly to all of our tissues. So basically, what heart does, heart pumps the blood to the tissues of our body. It pumps blood to all our organ system. It pumps blood to all of our body from the tip of our head to the tips of our toes. So basically, heart is the basic organ of our body which pumps blood to all of our body. So that if heart gets weak due to any problem, if heart is unable to pump blood due to any problem, then that condition is termed as heart failure. And that condition can be painful, and that condition can be devastating, a depressive illness as well if it is not managed properly. So today we will discuss the conditions of heart failure. So learning objectives for today's class are introduction, basic definition, brief summary of previous class, then epidemiology of heart failure, types of heart failure, pathophysiology and clinical signs, symptoms of heart failure, how to approach a patient with heart failure, and diagnosing a patient with heart failure, and management strategies for a patient with heart failure. So, heart failure, also known as congestive heart failure, is a syndrome caused by impairment in the heart's ability to fill with and pump blood. According to World Heart Foundation, approximately 64 million people worldwide are affected by heart failure, including diagnosed and undiagnosed cases based on global prevalence rates. So 64 million is a wild guess of the people working in World Heart Foundation. Many of these cases are not diagnosed as well, but they have a global prevalence rates. They have developed global prevalence rates, and they have speculated that if diagnosed cases are around 25 to 30 million, then there are also almost half of almost two times more people who are also not diagnosed with heart failure. So approximately 64 million people worldwide are speculated to be affected by heart failure, whether they are diagnosed or undiagnosed. It means nearly 1 in 5 person gets affected by heart failure at any time during their life. In the United States alone, in the United States, heart failure affects 5.8 million people, and each year, 505,000, 550,000 new cases are diagnosed. In 2011, heart failure were the most common reason for hospitalization for adults aged 85 years and older, and the second most common cause for hospitalization for adults aged 65 years to 84 years of age. So basically, after we cross 65 years of age, our heart starts to shut down, our heart functioning become decreased, and that is why most common reason for hospitalization after 85 years in 2011 in the United States was heart failure, and second most common for adults age 65 to 84 years was also heart failure. Nearly one of every four people, that is 24% hospitalized in the US with congestive heart failure, is readmitted within 30 days. Additionally, more than 50% of people seek readmission within 6 months after treatment, and the average duration of hospital stay is 6 days. So in the UK, despite moderate improvements in prevention, heart failure rates have increased due to population growth and aging populations. Overall, heart failure rates are similar to the four most common causes of cancer: breast, lung, prostate, and colon combined. So on the one end of spectrum, most common causes of cancer such as breast, lung, prostate, and colon combined do not kill as much people as heart failure alone. People from deprived backgrounds are more likely to be diagnosed with heart failure at a younger age due to chronic depressive problems in their lives, due to financial reasons, due to different kind of ailments. due to hypertension to diabetes going unnoticed, people not taking care of their health, and so deprived background people are more likely to be diagnosed with heart failure at a younger age. In tropical countries, the most common cause of heart failure is valvular heart disease or some type of cardiomyopathy. As underdeveloped countries have become more affluent, the incidence of diabetes, hypertension, and obesity have increased, which have in turn raised the incidence of heart failure. As all of the diseases which we have discussed in our previous classes, such as hypertension, diabetes, obesity, as well as coronary heart disease, all of these diseases raise the incidence of heart failure in population. So basic definitions: ischemia is defined as inadequate blood supply circulation to the lung area due to blockage of the blood vessels supplying the area. Ischemic means that an organ, example beyond the heart or brain, is not getting enough blood and oxygen. Angina is the discomfort experienced when the heart is deprived of adequate oxygen, and it is also called angina pectoris. This is a clinical syndrome characterized by discomfort in the chest, so, jaw, shoulder, back, or arms that is typically aggravated by exertion or emotional stress and relieved promptly with the rest or by taking nitroglycerine. Infarction, death of tissue resulting from failure of blood supply. So, a tissue is experiencing decreased blood supply, decreased oxygenation, and the tissue is in pain, tissue is emanating pain receptors, then that condition is called angina. And if that tissue starts to die because of that lack of oxygenation, that is called infarction. If the tissue is not dying, but if tissue is experiencing deprivation of adequate oxygen or adequate blood supply, that is angina, that is ischemia. But if the tissue starts dying, or if the tissue has died, that is infarction. So death of tissue resulting from a failure of blood supply, commonly due to obstruction of blood vessel by blood clot or narrowing of the blood vessel channel, then that the dead tissue is also called an infarct. Now, what is heart failure? Heart failure is a term used to describe a heart that cannot keep up with its workload. The body may not get the oxygen it needs. The term heart failure sounds like the heart is no longer working at all, but actually heart failure is sometimes called heart HF, means the heart isn't pumping as well as it should. So it's not like heart has stopped pumping altogether. It's not like that, because if heart stops working immediately, then we call it sudden cardiac arrest. That is not simply heart failure. In simply put, it is not just heart failure, it is cardiac arrest, because the heart has stopped pumping altogether. But heart failure is basically heart is pumping, heart is working, but it's not working the way it should. It's not working to the utmost maximum level of health the way it should. So basically, if the heart should have some ejection fraction around 55 to 65%, and the heart is working at around 40% or 35%, the heart is working, but it is not working properly. Pulmonary edema is a condition caused by too much fluid in the lungs. This fluid collects in many air sacs in the lungs, making it difficult to breathe. In most cases, heart problems cause pulmonary edema. And pedal edema. Uh, pedal edema is a condition caused by too much fluid in the lungs. This fluid collects in the many air sacs in the lungs, making it difficult to breathe. In most cases, heart problems cause pulmonary edema. And pedal edema, also known as foot or ankle swelling, is an abnormal accumulation of fluid in the lower extremities, specifically the feet and ankles. This swelling is often painless and can range from mild to severe, sometimes affecting both feet or just one. So pulmonary edema and pedal edema are the complications of heart failure, especially congestive heart failure. So basically, the heart is not pumping properly, and there is a backflow of blood in the venous channels of our body. As we already know, the veins of our body uh, collect blood from all of our body parts and distribute it to the major venous channels, which then dump their blood into the right heart. Now, in congestive heart failure or in chronic heart failure, when there is a left-sided heart failure, I will discuss what is left-sided and what is right-sided. When there is left-sided heart failure, eventually the backflow starts affecting right heart as well. And when the right heart becomes so filled up that it cannot take enough venous blood, which is coming back from our body, the blood and the fluids start to accumulate in our body, and if the fluid starts to accumulate in our lungs, then that problem arises in our lungs, and this problem is called pulmonary edema. Pulmonary edema is a condition caused by too much fluid in the lungs due to back pressure by the heart, which is not receiving the blood the way it should. And pedal edema is basically foot or ankle swelling, and it is also an abnormal condition of fluid in the lower extremities, specifically the feet and ankles. This swelling is often painless and can range from mild to severe, sometimes affecting both feet or just one. Preload. So preload, what is preload? Preload refers to pressure that fills the left ventricles during diastole, and afterload is the refers to pressure against which the left ventricle contracts. So the amount of fluid coming into the left ventricles from all of our lungs, both of our lungs, it's not all of our lungs, we have just got two lungs. The amount of fluid coming into the left ventricles from both of our lungs, the fluid is basically blood, that is called preload. Preload is the amount, the volume of blood which our heart has to pump into our body. And what is afterload? Afterload it refers to pressure against which the left ventricle contracts, the systemic blood pressure of our blood vessels, because our heart has to work against the internal pressure of our blood vessels. So afterload is basically the systemic blood pressure of our aorta, all of our major arteries such as renal artery, external iliac artery, common iliac artery, external iliac, internal iliac, then femoral artery, and if we go into the upper limbs and head and neck, then carotid arteries and brachiocephalic trunks, etc. So all of the arteries have their innate pressure, and the heart has to work against that pressure to pump blood into those high pressure blood vessels. These blood vessels are already high pressure systems. Their blood pressures are 120 systolic and 80 or 90 diastolic, and the heart has to create pressure that is more than 120 systolic in order to put pressure, in order to put blood into these blood vessels. Myocardial contractility. The power of contraction of heart muscles is called contractility. This mainly depends upon the adrenergic nervous activity and the levels of circulating catecholamines. So basically, the more we are charged, the more contractility our heart has, and the less we are charged, the less contractility our heart shows. So myocardial contractility is basically the power our heart muscles. So myocardial contractility is basically the power of our heart muscles with which they are contracting. Brief summary of previous class. As we already know, we discussed ischemic or coronary heart disease in our previous class. So it was epidemiology of coronary heart disease was understood, different types of ischemic heart disease was understood, pathophysiology and clinical signs symptoms, how to approach a patient with coronary heart disease, how to diagnose a patient with coronary heart disease, and finally management strategies for ischemic heart disease were discussed. And so now today we're trying to understand heart failure, although it is a very, very large topic. It is a very immersive topic. It is a very wide ocean of knowledge, but we have to extract the basic understanding of what heart failure is and what we need to do. So we have to extract the most basic understanding of heart failure out of all of this vast ocean of knowledge related to heart and the discipline of specialty which we doctors study is cardiology, and you need 5 years after basic graduation of Bachelor of Medicine and Bachelor of Surgery in order to become a heart specialist. So you have to study for 5 years further after basic graduation, uh, equivalent to doctoral levels, in order to understand what the working of heart is and how to manage the problems related with the heart diseases. So, in order to become a cardiologist, you need at least 12 years of basic as well as advanced medical education. Then you can become a cardiologist along with the core medical training as well. In this section, we will discuss all the brief clinical details regarding the basic understanding of heart failure. So, epidemiology of heart failure, according to 2017 American Heart Association data, heart failure affects estimated 6.5 million Americans aged 20 years and older, with improved survival of patients with acute MI, and with a population that continues to age. Heart failure will continue to increase in prominence as a major health problem in the United States for the coming decades as well. Heart failure is the primary cause of hospitalization in the elderly. An estimated 1 in 8 deaths is from heart failure. About 309,000 deaths caused by heart failure each year. Heart failure accounts for 8.5% of all cardiovascular related deaths. Approximately 960,000 new cases of heart failure are diagnosed each year in America. The annual incidence of heart failure in patients older than 65 is 21 per 1,000 population, which is quite high. Rehospitalization rate during the 6 months following discharge are as much as 50%, as we have already discussed in our introduction section. In 2012, the estimated cost of heart failure in the United States was $30.7 billion, 68% of which were direct medical costs. By 2030, the total cost is projected to rise to $69.7 billion, a nearly 127% increase. Men and women have a similar incidence and prevalence of heart failure. However, many differences remain between men and women with heart failure, such as following: the incidence of heart failure in men approximately doubles with each 10-year age increase between 65 and 85 years. It triples for women between ages 65 to 74 years and 75 to 85 years. Women tend to develop heart failure later in life than men do. And the mortality rates related to the heart to the owing to the heart related problems are also more in men. Heart diseases are more common in men, and more men die due to heart related problems than women do. Women are more likely than men to have preserved systolic function. Women develop depression more commonly than men do. Although heart problems are more common in men, but if a woman develops heart problem, she is more prone to develop depression related to that heart illness as well. Women have signs and symptoms of heart failure similar to those of men, but they are more pronounced in women. Women survive longer with heart failure than men do. If heart failure does develop in a woman, she tends to survive longer with heart failure than any man can do of same strata or same age group. Heart failure is a worldwide problem. The most common cause of heart failure in industrialized countries is ischemic cardiomyopathy. And what is ischemic cardiomyopathy? Basically, the pathology of the heart muscles related to the ischemia. So basically, weakening of the heart related to ischemic heart disease or coronary heart disease. And coronary heart diseases are due to cholesterol plaques forming in the blood vessels. So the heart is not getting enough blood supply. Although heart keeps pumping all of our body, but heart itself is not able to get the blood supply. With other causes including Chagas disease and valvular cardiomyopathy assuming a more important role in developing countries. However, in developing nations that have become more urbanized and more affluent, eating a more processed diet and leading a more sedentary lifestyle has resulted in increased rate of heart failure, along with increased rates of diabetes and hypertension. As we have already discussed, we already know the sedentary lifestyle, the processed foods, the sugars, the salt intake, fatty foods, not doing anything all day long, screen addictions, all of these things, along with hypertension and diabetes, they tend to increase the rates of heart failure in aging populations. Types of heart failure. Heart failure can be classified by which side of the heart is affected, left-sided, right-sided, or both. It can also be classified by the nature of pumping problem, such as systolic or diastolic heart failure. Additionally, heart failure can be categorized as acute or chronic based on the onset and duration of symptoms. So, the heart failure affects either the left or the right side of the heart, but sometimes can affect both halves. The type of heart failure is named for where it occurs in the heart. The following are three types of heart failure. Left-sided heart failure is heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Then there is right-sided heart failure. Then there is biventricular heart failure. Then there is congestive heart failure. Classification of heart failure based on the course of diseases. Heart failure can be classified based on the time of onset as acute heart failure as well as chronic heart failure. So I will this the major types of heart failure in a little detail. One is left-sided heart failure. There are further two types of left-sided heart failure: systolic failure or diastolic failure. The left ventricular in systolic failure, the left ventricle loses its ability to contract normally. So what is this? Because the ventricle contracts and pumps blood. So when left ventricle is unable to contract and unable to pump blood effectively, then that kind of failure is called systolic failure. The left ventricle loses its ability to contract normally. The heart can't pump with enough force to push enough blood into circulation. This is also known as heart failure with reduced ejection or heart failure with reduced ejection fraction, HFrEF. When this occurs, the heart is pumping less than or equal to 40% ejection fraction. So that is systolic fraction failure. And what is ejection fraction? I should have put the word ejection fraction in my definitions as well. I just forgot to put the word ejection fraction in my definitions because it is being repeated again and again. So ejection fraction is the amount of blood present in the left ventricle at the end of diastole versus amount of blood present pumped at the end of systole. So basically, if heart chamber is filled with uh, for example, let's say 500 ml or 400 ml of blood at the end of diastole when the heart relaxes and gets filled, and during systole, during contraction, half of that blood gets pumped into the aorta, then the ejection fraction of that heart is 50%, which is quite normal. 50%, 55% is quite normal. So basically, if heart is pumping less than or equal to 40%, then that is systolic failure because we have to um, eject at least 50% of our blood coming into the left ventricle from all of our body through lungs. Diastolic failure, the left ventricle loses. What is diastolic failure? The left ventricle loses its ability to relax normally because the muscles of the heart have become stiff. The heart can properly fill with blood during the resting period between each beat. This is also known as heart failure with preserved ejection fraction. So heart failure with preserved ejection fraction is basically the ejection fraction is normal, but the total amount of cardiac output has decreased because the stroke volume has decreased. So these things are a little bit complex, but I can't go into the details because if I start going into the details of the physiology of the heart, then we will not be able to cover the topic of our today's class. But basically, if the heart becomes stiff just like a leather bag, so the it cannot receive the amount of blood that it should receive. Even if the ejection fraction remains 50%, the amount of total blood coming into the heart and out of the total blood, the blood being pumped decreases overall. That is diastolic failure. So if a heart was supposed to receive 400 ml of blood, but heart is unable to receive 400 ml of blood, and it is receiving just 200 or 250 ml of blood, or just 100 ml of blood, then out of that 100 ml, even if the heart pumps 50 ml out of it, the ejection fraction will remain 50%, but the overall stroke volume and the overall cardiac output will decrease. Right-sided heart failure is right-sided or right ventricular heart failure usually occurs as a result of left-sided failure. When the left ventricle fails and can't pump enough blood out, increasing fluid pressure is transferred back through lungs. This damages the heart's right side. When the right side loses pumping power, blood backs up in the body's veins. Congestive heart failure. So congestive heart failure is sometimes called CHF, or it is also called chronic heart failure. It requires quick medical attention as blood flow out of the heart slows. Blood returning to the heart through the veins is less. This causes congestion in the body's tissue, as I have already explained. Often swelling, known as edema, results. Most often there is swelling in the legs and ankle, but it can happen in other parts of the body too. Sometimes fluid collects in the lungs and interferes with breathing, causing shortness of breath, especially when a person is lying down. This is called pulmonary edema. If left untreated, pulmonary edema can cause respiratory distress. Heart failure also affects the kidney's ability to dispose of sodium and water. This results in more blood volume. This retained water also increases swelling in the body's tissues. So, on the left side of the image, I have shown you systolic heart failure. So basically, the heart is dilated, the muscles have weakened, heart gets filled normally, heart receives blood normally, but weakened heart muscles can squeeze the blood out into the aorta, and that is systolic heart failure. In this case, ejection fraction will decrease. In systolic heart failure, the ejection fraction will decrease because the amount of blood coming into the heart is enormous, but the amount of blood being pumped into the aorta is very less. So that is systolic heart failure. And in diastolic heart failure, the muscles have become stiff. So this is basic understanding. There are many types, there are many variants, there are many other underlying problems, but this is basic understanding in what is happening in diastolic heart failure and what is happening in systolic heart failure. So in diastolic heart failure, the stiff heart muscles can't relax normally as written on the diagram. The amount of blood that is coming into the heart is very less, and out of that very less amount, the heart is pumping if the heart is pumping 50 to 55% of the blood being entered into the left ventricle, the overall amount of blood that our body needs exceeds the amount of blood being pumped by the heart. So we will call it heart failure because our body needs 80 ml per beat or 70 ml per beat, but our heart is providing 40 or 50 ml per beat per heartbeat. So our body is at a deficit of 20 to 30 ml. So there are some tissues which will not get proper oxygenation. There are some tissues which will not get enough blood supply as needed. And it is just because stiff heart muscles can't relax normally, and that is diastolic heart failure. So classification systems of heart failure. There are two classification systems. One system is American Heart Association stages, and one is New York Heart Association functional classification. So we will first discuss New York Heart Association functional classification, which is written on the right. So if there is grade 1, then there is no limitation of physical activity. Physical activity does not cause symptoms of heart failure. That is stage 1. And American Heart Association stages of heart failure is at high risk of heart failure but without structural heart disease. If a patient is at high risk of heart failure because of family history or because of some other systemic problem, then that is stage A. If there is structural heart disease in a patient but without signs and symptoms of heart failure, then that is stage B according to AHA stages of heart failure because the patient is prone to develop heart failure in stage B. But in stage B, the NYHA classification might be 1 or 2 because at stage B, there are chances that the patient has no signs and symptoms of heart failure. Even there is structural abnormality of the heart, but the heart is still doing its function properly. So NYHA functional classification is one. Patient is fine. Patient does not feel any kind of discomfort. Patient does not know whether his or her heart is damaged or not. But there is structural heart disease diagnosed on echocardiography or some other advanced modalities. Now, what is stage C of AHA classification? Stage C is structural heart disease with prior or chronic symptoms of heart failure. So, if a patient has structural heart disease, stage C according to AHA, stages of heart failure, then what is functional classification of NYHA at stage C? If the patient uh, can do ordinary physical activity, then it is still called NYHA class 1. But if there is slight limitation of physical activity, then it is NYHA class 2. If there is marked limitation of physical activity, but patient is comfortable at rest, but less than ordinary activities cause symptoms of heart failure, such as patient don't even can't even climb a set of stairs. Patient can even walk briskly, and if a patient walks briskly, they start feeling chest discomfort, they are too much breathless, they start feeling chest pain, etc. They start feeling dizziness, they start feeling pounding in the chest, and they start feeling squeezing feeling in the chest. So that is NYHA classification class 3. And if the patient is unable to carry out any kind of physical activity, even the patient cannot go to washroom without breathlessness or without chest pain, then that is class 4. The patient is morbidly gravely problematic. The patient is having severe symptoms of heart failure, and it needs management, otherwise the patient may die anytime. And if there is refractory heart failure requiring specialized intervention, then that is AHA stage of heart failure. According that, the patient is class D. And that person will, if a person has refractory heart failure, then NYHA classification of that person must be 4. So patient will not be able to carry out any kind of physical activities without symptoms of heart failure. So what is the pathophysiology of heart failure? So there is, first of all, there is initial dysfunction. So first of all, there is reduced cardiac output. The heart struggles to pump enough blood to the meet the body's demands. Then when the heart struggles to pump enough blood to the meet body's demand, then there are compensatory mechanisms to overcome aforementioned problem. The heart initially tries to compensate by increasing blood volume. This is achieved through fluid retention, leading to potential fluid buildup in the lungs and other parts of the body. How does blood volume increases? That is beyond the scope of this class, but basically there are some hormones such as aldosterone, etc., which cause sodium retention in our body, and sodium retention causes increased blood volume. So the heart thinks that it is trying to help our body increase the volume so that more and more blood reaches our body parts. Then heart rate increases, then heart muscles hypertrophy themselves. Heart muscles try to become stronger, heart muscle try to become more and more powerful, but with time this leads to a stiff non-compliant heart, resulting in diastolic heart failure, as we have discussed priorly. Then activating neurohumoral systems. These systems like the renin angiotensin system or aldosterone this is renin angiotensin aldosterone pathway, and then there is adrenergic compensatory mechanism which further increase blood volume, heart rate, and blood pressure, but they also contribute to long-term heart damage as well. So these compensatory mechanisms, in the initial 6 months or 1 year, they try to compensate for the shortcomings of the heart, and they do work. But after the disease progresses, after the heart damage increases, all of these compensatory mechanisms start to do more damage instead of helping us. So these compensatory mechanisms become maladaptive because increasing blood volume causes pulmonary edema, pedal edema, swelling in all parts of our body, especially the periphery, and the heart rate becomes increased. So the patient always feels as if the heart is pounding inside the chest, always feels a chest heaviness, always feels squeezing feelings. So these things can work for 6 months to 1 year, but in the long run, the heart, there is structural damage of the heart which is going on because the disease is not being treated the way it should be. So what is progression of heart failure? The heart failure has happened. Now there is a progression. There is a vicious cycle. As the heart continues to struggle, the compensatory mechanism eventually become maladaptive, leading to a cycle of worsening heart failure. Then there is myocyte death. Myocyte is basically muscle of the heart. The heart muscle cells called myocytes may die due to stress and lack of oxygen, further weakening the heart. There is no full blown heart cardiac arrest. There is not full blown myocardial infarction, but on microscopic levels many of the heart muscle cells are dying due to stress and due to overburden. Then when there is ventricular remodeling, the heart chambers can enlarge and become less efficient, and the heart muscles can thicken, making it harder for the heart to relax and fill with the blood. So there is other, the heart may get dilated or heart may get stiff. So in both cases, the damage has occurred. Then there is increased pressure. Increased blood volume and pressure in the heart and blood vessels can lead to fluid buildup in the lungs and other parts of the body, as I have discussed. So what happens? There is reduced cardiac output from heart failure, and the body senses it that heart is not pumping well. Heart should pump well. Body needs more blood, but the heart is not pumping more blood. So what happens? There is activation of renin angiotensin system in the kidneys. This system causes renin release. The renin converts angiotensinogen to angiotensin 1. This angiotensin 1 then goes to the lungs, where angiotensin converting enzyme converts angiotensin 1 to angiotensin 2. Then this angiotensin 2 further activates adrenal glands. Adrenal glands then secrete aldosterone, and pituitary gland secretes antidiuretic hormone. So both of these things, the angiotensin 2 is doing the aldosterone release and antidiuretic hormone release. Both of these things call fluid retention. So there is increase in volume, increase in overall volume in our body, and the increasing volume in our body at first helps the heart. Heart feels that now it has started pumping more and more, but in the long run it starts to damage our heart. Then there is carotid baroreceptor response, increased activity of sympathetic nervous system because our body is in pain. So sympathetic nervous system activates and it feels that the heart is not pumping properly, so we should do something. The sympathetic nerves start doing something, they start firing more and more, the heart rate increases, and positive effects on myocardial contraction occur, the inotropy occurs. But the, in the long run, if the heart is beating at more than 90 beats per minute or more than 100 beats per minute, in the long run the heart gets exhausted, because the heart is made to beat around 70 to 80 beats per minute. And if we make it beat faster, if we make it beat stronger than it should for longer periods of time, eventually it will get exhausted. So uh, sympathetic nervous system fires for the first few months or for the first 1 year or so. It works, we feel good, we are not taking care of our heart. Our heart is getting sick and sick, but we, our body is trying to compensate because we are young, we are healthy, we are taking junk food, we are still getting obese, we are still not taking care of our hypertension, we are still not taking care of our diabetes, we are still not taking care of our dietary cycle, we are still not taking care of our routine exercises. So heart rate has increased, contractility has increased, but in the long run it is exhausting our heart. So after 6 months or 1 year, what will happen? Vasoconstriction and increased BP will start to weaken our heart, and negative remodeling of the heart and left ventricular function will occur. Either our left ventricle will start dilating, due to it will cause a dilated cardiomyopathy, or it will become stiff. So in both cases, heart failure symptoms start to getting appear. So even if the heart is becoming dilated like a balloon, eventually the functionality of heart is not good. And if heart becomes hard leathery bag, and that is called diastolic failure. still the functionality of the heart is not good. So in both cases, we are doomed. So heart failure has occurred, but what are its risk factors? So non-modifiable risk factors are age, gender, and family history. You can't change your age, you can't change your gender, you can't change your family, you can't change the fact that your mother and father had some heart related problems, and the heart related problems are there in your genes. You can't change these things. But medical conditions, previous history of myocardial infarctions, valvular heart disease, coronary artery disease, all of these things can be managed properly. Valvular heart disease can be managed properly. Coronary artery disease can be managed properly. Previous history of MI, and then if you have a previous history of MI, then what no what to eat, what not to eat, what medications to take. You can change these things to some extent. So there are some non-modifiable risk factors which you can change, but there are some medical conditions which can be managed properly, and then there are modifiable risk factors such as high blood pressure, smoking, diabetes, obesity, unhealthy diet, excessive alcohol consumption. All of these modifiable risk factors you can change. So if you manage your medical conditions well, if you manage your modifiable risk factors well, your heart can live longer. So, what are the signs and symptoms of heart failure? When evaluating a patient, a detailed history and examination are required to determine whether there are symptoms and signs of indicative of heart failure. It is prudent to consider whether these symptoms and signs occur in the context of cardiac damage, for example, in acute coronary syndrome, in which case the correction of ischemia will take precedence. Chronic heart failure is characterized by multiple symptoms that are not specific to the condition. The main clinical symptoms are breathlessness, fatigue, and ankle swelling. Although suggestive of heart failure, these are not diagnostic symptoms because ankle swelling can occur in renal diseases as well. Breathlessness can occur in pulmonary diseases as well as renal diseases as well, and fatigue can occur in a variety of diseases. Fatigue can occur in simple typhoid fever, fatigue can occur in simple flu, fatigue can occur in simple anemia. So all of these things, all of these symptoms are not pathognomic for heart failure, and they are not diagnostic symptoms, as they can occur in any other medical conditions, including chronic obstructive pulmonary disease. Other symptoms described in heart failure include orthopnea, that is breathlessness when lying flat, paroxysmal nocturnal dyspnea, sudden breathlessness, awakening patient at night. So these are the things when you start hearing from the patient's mouth, you should think that the patient is suffering from the symptoms of heart failure. Reduce exercise tolerance and cough. So if patient says that they cannot even walk briskly and they start coughing, then there is a problem. Tiredness and fatigue, a tired feeling all the time and difficult with everyday activities such as shopping, climbing stairs, carrying groceries, or walking, etc. Lack of appetite, confusion, impaired thinking, and memory loss. Changing level of certain substances in the blood, such as sodium, can result in reduced blood flow to the brain, which can cause confusion. Increased heart rate, such as heart palpitations, which feel as if your heart is racing or thrumming. So, all of these signs and symptoms may point out that the patient is suffering from the symptoms of heart failure. So you take a good history, you do a proper physical examination. First of all, general physical examination. Then you go toward the systemic examination. This may include checking vital signs, listening to the heart and lungs, looking for signs of heart disease such as swelling in the legs or abnormal heart sound. So physical examination in heart failure shows if you hear the heart sounds, then there are two heart sounds called S1 or S2, which are normal heart sounds. But if there is S3 gallop, if there is an additional heart sound, then there is highly specific cause for heart failure. And it S3 gallop is a heart sound which is present in a patient with symptomatic heart failure. So if a patient is having symptomatic heart failure plus volume overload, then you do not hear two heart sounds, which is lub and dub. First, if you hear to the heart sounds lub dub, lub dub, lub dub, but there is an S3 gallop, named from galloping horses. So there is a constant galloping in between lub and dub. S1 and S2, there is a constant galloping due to in symptomatic heart failure in a patient with volume overload. You hear this constant gallop when you apply a stethoscope on the patient's chest, It is low sensitivity, but it is highly specific for heart failure. Patient may have cool, pale, and cyanotic extremities, have sinus tachycardia, diaphoresis means excessive sweating, and peripheral vasoconstriction, crackles or decreased breath sound at bases of lungs, elevated jugular venous pulse, lower extremity edema. There might be ankle swelling present on both feet. There might be ascites. Is fluid accumulation on in the abdomen. There might be hepatomegaly. Hepatomegaly is increased size of liver. There might be splenomegaly. Splenomegaly is increased size of spleen, and there might be displaced apex beat. So all of these things you may find in a patient with heart failure if you examine the patient thoroughly. Then how if you have done all of this history, if you have taken all of this history, if you have done all of this examination and you suspect that the patient is having heart failure, how do you diagnose this? So basically you run some basic tests such as complete blood count, serum electrolytes, and creatinine, because you have to know whether the kidneys are functioning properly or not. Then fasting blood glucose levels, thyroid function tests, because thyroid problems can also cause heart failure. Then iron studies, because many of the times severe iron deficiency anemia can exacerbate the conditions of heart failure, and if you treat anemia, the heart failure symptoms start disappearing. Then ANA levels, this is a test, basically anti-nucleotide antibody, to evaluate for possible lupus erythematosus. So lupus erythematosus is an autoimmune disease, and we run some basic autoimmune antibody tests. ANA is one of them. Then viral studies, if viral myocarditis is suspected. For myocarditis is basically inflammation of the muscles of the heart due to some viral infection. So if you are suspecting some acute heart failure, because if a patient who is previously healthy, has no diabetes, no hypertension, etc., but their heart is failing, with the clinical signs and symptoms of some fever or some flu-like illness, then you suspect viral myocarditis, and there is some virus who is damaging the heart muscles of the patient. So viral studies should be done in an otherwise healthy person who is experiencing symptoms of heart failure. And viral myocarditis is a life-threatening illness, so it should be treated promptly. So, if there are heart failure symptoms and if there are elevated risk factors and you are suspecting heart failure, I'm studying this infographic diagram. You perform an electrocardiogram, which is ECG, or in America they also call it EKG, and we can do an echocardiogram. Echocardiogram is basically an ultrasound scan of heart. A specific specialized ultrasound scan of heart is called echocardiogram. Then there are some natriuretic peptides levels in our blood, which we detect by studying the serum levels of natriuretic peptides. Then there are some lab analysis as well, such as levels, glucose, HbA1c levels, CVC, thyroid function levels, lipid panels. So, laboratory analysis is done, natriuretic peptides are checked, echocardiogram is done, ECG or EKG is done, and all of these things tell us what is the cause of heart failure. So all of these things, all of these lab analysis, whether there is some thyroid problem, whether there is some severe anemia, whether there is some viral myocarditis, whether there is some other cause, and EKG tells us about the functional abnormalities of the heart, the electrical rhythms abnormalities of the heart, and echocardiogram or ultrasound examination of the heart shows whether there is any kind of structural abnormality of the heart, whether there is any kind of a hole in the heart, any kind of septal defect, any kind of valvular problem, any kind of heart valve problem, any kind of regurgitation of blood, any kind of leaking of blood, all of these things will be shown through ultrasound scan of the heart. So all of these things combined then tell us what is the cause of the heart failure. If there is some specific cause, point oh no, we can find some specific cause, we start treating those specific causes, and we start getting treating the patient. So BNP levels, what are basic natriuretic peptides, brain natriuretic peptides? With chronic heart failures, atrial myocytes. Atrium is our heart chamber. So atrial myocytes secrete increased amounts of atrial natriuretic peptides and brain natriuretic peptides in response to high atrial and ventricular filling pressures. Atrial natriuretic peptides and brain natriuretic peptides are basically natriuretic peptides. They cause the diuresis or natriuresis. So basically, they start excreting excess sodium from our body so that the volume overload can be treated. Usually, a level of more than 400 picogram per ml in patient with dyspnea due to heart failure is diagnostic of heart failure. Chest X-ray may also show cardiomegaly, cephalization of pulmonary vessel, curly V lines, pleural effusions, pulmonary vessel congestions, pulmonary edema. How to read an X-ray with a patient with heart failure, that is beyond the scope of this book. But you should know that X-ray does show some features of the heart failure in a patient. BNP levels can be done, serum CDC can be done, thyroid profile can be done, EKG can be done, ultrasound scan, which is called echocardiogram of the heart, should be done. Then BNP levels or natriuretic peptide levels should be done in order to point out what is the cause of heart failure. So, if you have diagnosed a patient with chronic heart failure, how do you manage it? So, basically, chronic treatment of systolic heart failure is correction of systemic factors such as thyroid dysfunction. If there is thyroid dysfunction, you treat the thyroid problems, you treat the infections, you treat uncontrolled diabetes, you treat uncontrolled hypertension. Then there is lifestyle modification, lower salt intake, lower sugars and fatty foods intake, alcohol cessations, and encourage organic foods intake instead of processed food. Medication compliance is very, very important. Discontinue drugs that may contribute to heart failure, such as NSAIDs, antiarrhythmic drugs, calcium channel blockers, etc. So basically, it's a holistic approach. You just do not start bombarding the patient with medications. You change their lifestyle, you change their dietary habits. You also study whether the heart problem is primarily due to heart problem or is it is secondary to some other illness, such as thyroid, such as some infection, such as diabetes, such as hypertension. If the heart problem is secondary to some other illness, you need to treat that illness, because if you are not treating that illness, the heart problem will not go away. Heart problem is just a complication of some other illness, so you have to treat that illness as well. So I hope we are not getting too much slow, because I'm about to end it. So management of chronic heart failure continued. So order of therapy is leukotrienes and ACE inhibitors. These are the name of drugs. I will not go into the details of these drugs. And then beta blockers, digoxin, hydralazine, nitrates, potassium sparing diuretics. So basically, you give these medications in a patient with heart failure. And management of heart failure is through general measures, through medications, and through device therapy. There are some general measures, as we have already told, that exercises, control your smoking habits, control your alcohol intake habits, control your processed food intake, change your sedentary lifestyle, etc. These are basically general measures. Then there are some medications such as diuretics, ACE inhibitors, beta blockers, etc. As we are already told, then there is physical correction as well. If we are having some ischemic heart disease and if there is a plaque in a coronary artery, we can go for angioplasty or coronary artery bypass grafting cabbage. Valve repair or replacement can be done in valvular heart disease. So these are surgical options for treating heart failure. Then there are some device therapies as well, such as cardiac pacemakers. And cardiac pacemakers are applied in patients when there is a problem with electrical rhythm of the heart. So these are the prevention strategies for heart disease and heart failure. We have discussed this slide in our previous class as well when we were discussing ischemic heart disease. So you have to control smoking, you have to control your unhealthy body weight, unhealthy diet, sedentary lifestyle, obesity, high cholesterol levels, high blood pressure, diabetes mellitus. And if you control all of these undesirable health behaviors and risk factors, then your heart will stay healthy. But if you are unable to control all of these things, your heart failure will start to happen. You may suffer from strokes, you may suffer from coronary artery disease, you may suffer from any kind of heart diseases. And we should have some physical activity. Tips for a healthy heart are very important. We should have some physical activity. We should start having regular exercise. We should start measuring our blood pressures after the age of 40 regularly. We should eat a healthy diet. We should not eat. We should get enough good night's sleep. We should be physically active, and we should manage chronic conditions such as high blood pressure, diabetes, and hypercholesterolemia. And we should take these conditions seriously, because eventually all of these conditions damage your heart, damage your brain, and your life quality becomes poorer and poorer with every passing day. Have a nice day. Thank you. This was a very, very vast topic. I tried my best to deliver it in as simple way as possible, but I think I could not do the job properly, because this topic is a complex topic. This topic is a specialized topic. But in the end, if you are able to even get 50% of what I wanted to make you learn, then that is my success, because the basic understanding of how to approach a patient with heart failure, I hope I delivered that basic understanding to my students. So, any questions, please? So, first
We
of
can
all,
allow uh, uh, 6 minutes of questions. So let's see what CC Jules has to
6 minutes.
say.
6 minutes is less, but
Thank you.
yes, we can
Thank you
try
very
to
much.
manage. We can try to squeeze
It
in.
was a very great presentation. So about the health being. So I have only three questions, very, very relevant. The first one is
Okay.
heart failure causing heart attack or vice versa. Is the heart failure
Okay.
that cause heart attack, or it is heart attack cause heart failure? Second question,
No,
what is
basically,
appropriate therapies among overall method you present to fight definitively against the heart failure? And the last, what medicines are recommended mainly to prevent or heal definitively heart failure?
so
You have the
we
question
have
in the chat
already
box.
discussed.
Yeah, you have the question in the
Okay,
chat
okay,
box. You can see.
okay, okay. So basically, we have discussed the second and third question. What medications can be used, and what kind of lifestyle changes can be done. We have discussed these things. But the first question, which actually need to get I need to give you answer, is heart attack is not heart failure. Heart attack is basically uh, an episode of myocardial infarction or severe ischemia due to occlusion of any kind of heart vessel, due to
Okay.
which the contractility of the heart has acutely decreased. That is heart attack. But heart failure is basically after a, a heart attack. What happens with the heart is heart becomes weakened, heart becomes damaged, and now it is unable to pump the way it used to pump before any kind of heart attack or any kind of heart damage. That is heart failure. So basically, heart attack is the term which we use in layman terms when there is some kind of occlusion of a blood vessel of the heart, and
Oh,
heart's
okay.
blood supply gets decreased, and some part of heart mm, gets damaged. And if due to that damage, the heart is not functioning properly in acute terms, the patient presents within minutes. The patient cannot wait, and that is a medical
Okay.
emergency. You have to manage it. The patient should be rushed to the hospital immediately as soon as you suspect that the patient is having heart attack. But heart failure is a wide problem. Heart failure is a chronic problem. The patient can
Okay.
have heart failure, and the patient can live up to 10 years even after experiencing the symptoms of heart failure. Although the
Okay.
lifestyle and the quality of life is very much ruined, because the patient cannot walk properly, patient cannot do aggressive physical actions, patient cannot walk briskly, patient cannot do this, patient cannot do that.